Although hepatitis is a serious illness, many people recover completely. However, anyone who has had hepatitis should abstain from alcohol for at least 6 months after an attack. Hepatitis is a highly contagious disease that can affect people of any age. However, it is more common in young people and those who work in industries that handle contaminated material. Because young people are more likely to engage in risk-taking behaviors, this disease may primarily affect this age group. The disease inflames the liver and is caused by viruses transmitted through blood, saliva, or feces. Hepatitis A and B are the two most common viruses. There is also hepatitis C, which is transmitted in the same way as hepatitis B but occurs when neither the A nor B viruses are present. Hepatitis D, E, and F are also present, though they are less common. Hepatitis D is not contagious, but it can cause a severe liver infection if combined with hepatitis B. Hepatitis A is primarily transmitted through contaminated food or water and is occasionally found in areas with poor sanitation and inadequate housing. It is infectious only during the incubation period and is not spread by carriers. It can also be spread through contaminated blood products. Hepatitis B has a longer incubation period, which can last months. It is usually spread by infected blood, which is often the result of blood transfusions or the sharing of infected intravenous needles. Fortunately, due to the availability of blood screening tests in the West, transmission of this disease via blood transfusion is almost unheard of. However, transmission via shared intravenous needles remains an issue. It can also be spread by contaminated tattoo needles and razor blades. Sexual contact is another mode of transmission. If a pregnant woman contracts hepatitis B, the virus can enter the fetal bloodstream and infect her unborn child. Most hepatitis A and B infections are mild, but they leave chemical evidence in the blood, which is detected by blood tests. If the infection is severe enough to cause significant liver inflammation, it impairs the liver's ability to eliminate bile pigments. This causes bile to enter the circulatory system, resulting in jaundice, or a yellow tinge to the skin and whites of the eyes. Before the jaundice becomes visible, the patient frequently feels ill for some time. There is pain in the upper right side of the abdomen, as well as joint pain that is similar to arthritis. A rash is also possible. While the jaundice is obvious, the person frequently feels nauseated and vomits. This usually lasts no more than 2 weeks, and the patient is usually fully recovered within 6 weeks. If the virus is not eliminated from the body, the person becomes a carrier. While many people are unaffected, some develop chronic inflammation of the liver, which can progress to cirrhosis of the liver, a potentially fatal disease. Because hepatitis A has no carrier state, this is only a problem in hepatitis B or C. Hepatitis is easily diagnosed when the typical symptoms are present. Blood tests can confirm these findings. Antibodies are present in the blood when the patient has recovered from the disease. If there are no antibodies, the patient is still infected. If a doctor suspects that a patient is developing chronic liver disease, he may order blood tests or a liver biopsy. Not all hepatitis patients require hospitalization and can often be treated at home. Expectant mothers, diabetics, and the elderly are among those at risk, and these individuals are typically treated in a hospital. To avoid cross-infection, whether the patient is in the hospital or at home, separate cooking and eating utensils must be used. Hygiene must be taken extra seriously. During their illness, the patient should not take any medications and should not consume any alcohol. Because alcohol is a poison to the liver, it must be avoided for at least 6 months after hepatitis. The majority of hepatitis attacks are mild and result in full recovery. Hepatitis can reoccur, but it is rare that it is caused by the same virus. Patients who are carriers, on the other hand, may experience a relapse. The best advice for someone who has had hepatitis is to never drink alcohol again. In the absence of that, he or she should abstain from all alcoholic beverages for at least 6 months.